Diabetes. Now, you've been diagnosed with diabetes, and then you come to me and you tell me, Doctor, my blood sugar levels are very high, but I don't want to start on some medicines and take them all my life. Or you come and tell me that I have already started on some medicines and my levels are in control, but I don't want to continue to take them all my life. I would like to try some alternative solutions to my diabetes. Or you come and tell me I am on medication, but my sugar levels are just not coming down. I've been asked to do a strict diet and exercise. I do it to some extent, but I just can't keep doing it for a long time, or I can't keep it going. Now I ask you, what are you experiencing? What are your symptoms? And you tell me that I have excess hunger, I have excess thirst, I have excess urination, I'm losing weight without doing any exercise. I have burning and numbness in my feet and soles. It prevents me from sleeping in the night. My wounds take time to heal. I keep getting chronic skin issues that does not respond to treatment. I have lost interest in sex. I have a burning in my soul which just does not allow me to sleep in the night. I have numbness in my hands and legs, which they call it as diabetic neuropathy. I sometimes get sores in my private areas, which just does not go away even with treatment. So these are all the symptoms that people experience because of diabetes. Are you aware that there are an estimated 72 million cases of diabetes in India? It is so common that you would know of so many people who have diabetes within your family, relatives, or friends. But still, the moment you are diagnosed with diabetes, your life comes to a standstill. Now you get all sorts of advice from friends and relatives. They tell you what to eat, what not to eat, what to do, what not to do, how to live your life, how not to live your life, etc. Now all this affects you psychologically and you suddenly begin to age. And nowadays most diabetics are diagnosed at a very young age without even any symptoms. Obviously, you are listening to me because you've been diagnosed. Let's not waste trying to discuss the technical aspects of what diabetes and all that. It doesn't make sense or nor is it useful. It is a well-known fact that diabetes is hereditary and most people get diagnosed in their 30s after going through some anxiety, stress, tension. Now, world over, it is accepted fact that stress triggers and maintains diabetes. Many people believe that BP and diabetes come due to stress. Now, once you're diagnosed and you go to the doctor, he will prescribe medicines to bring down your sugar levels. Now, what you need to understand is increased sugar levels are only the effect of diabetes, which is effectively controlled by allopathic medication. But the cause and maintaining factor of diabetes is fast. F for fear, anxiety, stress, and tendency. This is just not considered while treating it. Hence, only the control of diabetes is happening because you are treating only the effect of diabetes, not the cause. Here is where homeopathy can be of help. Homeopathy has very effective medicine to treat the cause, the trigger, and the maintaining factor that are stress, anxiety, and tension. If homeopathy and allopathy are used together, the homeopathy treats the cause and the allopathy treats the effect, that is the raised blood sugar. This will not only help you to control, but there is a possibility of a cure of diabetes also. Or once you are on allopathic medications, once you start on homeopathic medications, as your levels get better, you slowly taper off the allopathic medications, and over a period of time, we've been able to get people out of their allopathic medications. We have treated our diabetic medicines that we used more than 27,000 times by our patients, and we've been able to help a lot of them. Now, people call diabetes as a lifestyle disease. Now, it is a chronic disease. It is not something that will just go away with medication. Medicines will only control the effect of it. If you want your diabetes to be effectively treated, then there is something that you have to do. There are certain things that I have to do as a doctor. So, this is a journey that both of us have to do together. So one of the prime most important thing that you need to understand is in search of comfort and conveniences, we have gone away from our source of creation, that is the earth, the water, the fire, air, and space. We are made up of the five elements, but it is not in control. That is one of the main reasons why we end up in chronic diseases. So it is very important to balance them. I have made a comprehensive video about how to balance the five elements, which is available on the website. Please start and make sure that you balance the five elements. This is the first thing that I would tell you. The second thing is a study has revealed that most chronic diseases happen because of emotional conflicts that happen in us, or it happens because of a lot of unpleasant events. These are trapped within ourselves from childhood till now. Some of them are consciously there, some of them are unconsciously there or subconsciously there, which you are not aware of. So there is a need to explore all these trapped emotions within you and untrap them. And this can be done by a 1 hour audio which I have created. You can get the link. And if you do that, you will be working on your diabetes, not only medicine, but even beyond medicine also. There is a need to look at diabetes not just as a medical problem, but as a problem which is beyond medicine. So get onto this treatment and be in touch, and your diabetes will definitely be in control. Don't worry, there are millions out there, all of them live a good life. Unfortunately, the human mind is such that we only look at the worst that can happen to us. The moment you're diagnosed with diabetes, you search over the net and then you figure out that your kidneys can fail, your heart can fail, that can happen, this can happen, and you start imagining all that happening to you. It is only very few percentage of the people who go into such complications. Majority of them, they live a happy life and they die without any complications. But we don't look at all those people who are well. We only look at the minority of them who go through a lot of things and we imagine it happening to us. And unfortunately, our body is designed in such a way that the body will always listen to what the mind says. So we manifest these kind of unfortunate events. So stop suffering from diabetes mentally from today. Physically, what you have, we can take care of. But what you're suffering mentally because of diabetes should end. So we do this journey with you. Please don't worry and you take care.